How do you actually evaluate your students during technique exams?
We have two ways of doing it. We do it with setups during class hours, where they have to do a setup and they have to pass it, and they have to pass 2 setups each module. If they don't pass these setups, then they can't go to the final exam. And it's randomly chosen setups, so we have time allocated for it, where they just choose whatever they've been through. Then they get evaluated. We have an evaluation sheet, and if they don't pass it, and a lot of them don't because they don't take it serious. The good thing about it is that they get feedback afterwards, so they know what's gone wrong. So, and when the first time that they don't pass, then they start to take it serious, and then they start to realize that it's important to practice, and it's important that they get up at a certain level. So we have those two during teaching time, and then at the final we have an OSCE examination. Are you familiar with OSCE? OSCE examination is where it's a practical examination where you have 10 minutes each station. We have 6 stations, and then we have a little bit of the theoretical question and then a practical skill that they have to perform according to certain criteria on each station. And then they go on to the next station, and then they go on to the next, and then so they go through 6 stations, and on 6 stations you can actually, most of the time you can examine virtually everything. So you get a very good idea of where they are with their skills. And they can only, I think it's, if they don't pass 3 of the stations out of the 6, then they fail. It's very well planned because there's certain criteria that they have to fulfill, and don't they fulfill those criteria? And it's usually criteria set in terms of for patient safety. I mean, is it safe to let them pass with the amount of skills they have, with the focus on the patient? So that's how we assess them. Now that's going to change quite a bit when we're starting to use video, because we will use video as part of our assessment plan, but it hasn't been developed yet.